Hello, and welcome to another episode of Real Talk on Renal Cancer, sponsored by the Judy Nicholson Kidney Cancer Foundation. We are so grateful for our support from Exelixis, Ipsen, and Merck. And I am so thrilled today to have our guest on, Sid Sadler. Welcome to the podcast. Very happy to have you here.
Yeah, I appreciate you having me on here. I'm excited to chit chat.
Thank you. So, Sid, for our listeners at home that aren't familiar with you and your social media endeavors, tell us a little bit more about yourself and how you got, how you became the kidney cancer guy.
Yeah, what led me here? So back in December of 2023, so this past December, I had a tumor that was found on my left kidney. As many people, a lot of people, they don't have symptoms or signs or symptoms. I had blood in the urine, so we went for a CT. I'm not going to bore everybody with all the details because these stories all kind of line up with how they're usually discovered or how it happens. But I was lucky enough to be seen by some awesome doctors at Vanderbilt University in Nashville. I live about 40 minutes outside of Nashville, and was very awesome to be seen by some great doctors there. And I had a left radical nephrectomy. So they took my whole left kidney out along with a 10.5 centimeter mass. So it was a fairly large tumor, not the biggest by any means, but definitely not on the small end. And I was diagnosed with stage two. I have to always remember to add the B because there's two different types of stage twos, I think. So stage 2B, grade 2 clear cell renal carcinoma. So um, fast forward past my diagnosis and all the stuff that I'm sure we'll talk about here in a little bit. And I have a background in communications and social media and community work as well, and a degree in nonprofit management. So I feel like there's usually people go in two different ways after their diagnosis, and sometimes there's a middle, but people will kind of go about their lives and try to forget about their diagnosis, and that's perfectly acceptable and perfectly fine. And I think that can be therapeutic for folks. Myself, I was not able to do that. It is not in my DNA too. So I found that leveraging my background in social media and communications with those experiences really led to one, just being therapeutic, and also just meeting some extraordinary people, yourself included, Katie Coleman, etc. Those folks as well led me to kind of realize what I could actually do with my background and trying to help other folks.
Yeah, I love that, Sid. And I can completely relate because I took a similar path myself. I don't think I've shared this on the podcast before, but kind of how I started in patient advocacy was my oncologist, who unfortunately has since passed away. But he was sitting down with me one time in an appointment, and he's like, you work on marketing in for casinos. Like, why don't you do it for something better? I was like,
And you're like, oh, gee, I haven't thought about that.
fair point. Okay, all right. I guess I'm getting kind of bullied into patient advocacy, but no, I'm glad that he said it. But yeah, but no, I
Yeah.
can relate because for me, I think it was therapeutic too. I mean, and it's
Hmm.
still therapeutic. I think getting involved in patient advocacy and whatever that looks like, and that looks like something different for every patient, right? But
Hmm.
for me has put some purpose to the pain that I've been through, and it's made me feel like I have some control over, what has happened to me.
Yeah, I agree with you 100%. And I love the point that you made that it looks different, right? Because I think some
Yeah.
people, I've talked to other patients, and I am in no means, I try my best. Like, I have people now coming to me and asking for advice, but I am by no means, at least in my own accordance, not an expert. I mean, I was diagnosed my mass was found in December. It hadn't even really been a year since my surgery. But I'm one of those people that try to just dive into the deep end of the pool and try to surround myself with other patients, advocates, organizations that I know are vetted and know that they have people's best interest in mind. So when it comes to social media, that's just like one avenue, right? Some people aren't comfortable with social media, and I understand it because I'm 33, and people around me, like the organization that I do work for in their communications department, they consider me extremely young, but in social media years, 33 is not very young.
Yeah, we're
For
ancient
those
in
of you
our
out there,
terms. Yeah,
yeah,
and
for those
in
of you
social
out there,
media terms.
social media terms, 33 is old. So keeping up with the Joneses, or however you want to put it, that can be intimidating. So, and with Vanderbilt, where I was treated at, I was just meeting with their young adults and patient advocacy folks over there, and they're really interested in having me do some things over there. But that's another avenue, right? Like you could
Yeah.
go where you got treatment, and for me that is very special to try to give back there, because regardless of how people feel about healthcare and medicine, et cetera, that place, their doctors, their nurses, made that experience that I was terrified beyond belief. They made it as easy as possible for me to go through that. So I felt like it was important to give back in that avenue. But the point about it being, it can be in different avenues. It doesn't have to be social media. You don't have to go make funny TikToks. You can do it in other avenues as well.
Absolutely. And I think that you brought up some really good points. First of all, you are an expert on yourself, right? I always say that is and I know what you mean though. I mean, I always say I'm not a doctor, I'm not an oncologist, right?
Right, right,
But I do think that it's what I've appreciated about the relationships I've built with oncologists and researchers throughout the years is that they understand that we do bring a certain level of experience to the table, right? It's not,
right,
maybe we haven't gone to medical school, but we understand what a nephrectomy is like from a patient's perspective, which is really important. But I do want to pull on a thread a little bit about what you were talking about, because to your point, you are young. I'm also a young patient, as you know, not as young as I used to be, but I am, especially for the kidney cancer demographic,
exactly.
we're younger than a lot of our fellow patients.
Hmm.
And so what was that like for you to be diagnosed 33, your prime of your life, right? And then bam, cancer diagnosis.
Right. So I think, I go back to when that was found, or when kidney cancer was mentioned. And I've had this conversation with other patients about the importance of kind of this age group where you're in. And I was recently at the KCA, a symposium that they had for patients, and they had this graph on the board, and it showed that 83,000 people will be diagnosed with kidney cancer in, this year. But of those 82,000, 1% will be my age group, the 30s, if you will, or whatever. And that was kind of crazy to see. Now, that was post surgery, post diagnosis. I knew that it was fairly rare, but getting that diagnosis at that age it's just weird. It's kind of an outer body experience. Like, I still remember vividly sitting in my doctor's office. My primary care physician was the one who ordered the CT scan, and he called me and he asked if Rachel, my wife, could come with me to the appointment. She's a nurse practitioner, and he knows that. So I think he was just thinking like, hey, it would be good to have her there. And right when he said that, I was like, this isn't good news. Because if it was anything else, kidney stones or something like that, and then, but that's kind of an outer body experience. And I think when you get a diagnosis that young, also, you have all these things in life that not everybody's like started their life at 33 or 32. I was technically 32, but I'm 33 now. And not everybody started their life. Not everybody has had children if they want children. Not everybody has started a career if the certain career that they wanted by 32 or 33. So I think you get this mixture of people that sometimes think that this is older on the cancer spectrum, but no, for kidney cancer especially, it's extremely young. But for really any cancer, or to go through a diagnosis like that, it's very weird. It's like and I don't have to explain it to you, because you have walked that line. But I think it was important for me to try to find that connection with other people. So the first thing I did when I got that diagnosis was I went on TikTok and I typed in kidney cancer, and the first thing that popped up was Katie Coleman. And from there, I like sent her a message like a crazy person. And I was just like, I spilled all of my guts. Like I probably, it was like somebody talking to their priest, right? Like I was just spilling my guts all over the place. Because this was like 2 days after this mass was found. And the mistake that people make is they go on Google. We all know here in this community, and really in the cancer community, Google's the worst thing because the numbers are backwards looking. You don't have anything, like you're not talking to specialists, et cetera. You just see Google and you think automatically the worst thing ever. And thankfully, we have somebody like that was already posting on social media and talking about their experience. Now, granted, I had no clue what my staging was or my grade or even the type of kidney cancer that I had. And I had no clue until a week or so later that her cancer was quite different than what my kidney cancer was. But regardless, there are still some similarities when you get when you get the word cancer from a doctor and you're 30, you're 32. And yeah, it's just weird. Weird would be the way I would put it.
It is. Well, and I think too, gosh, so many good nuggets from what you said. I want to make sure that I capture them all because I think that it's so relatable, right? I've talked with Katie and other patients about this before, how you have to make some of the most difficult, challenging decisions about your care when you know the least, right? Like I always say
Right.
that I hope I never have a recurrence, but if I do, I feel, even though I would be terrified to have one, like I feel much
Right.
more empowered now than I did 8 years ago
Mhm.
because I just understand
Yeah.
my disease so much better. I have the right care team in place, right? Like, so it's still a boogeyman, but it's the boogeyman I know, right?
100%. You've swam through the swamp. You
Yeah,
know the
right.
different. Yeah. You know
Exactly.
exactly what's there. Hmm.
Exactly. And so I think that's what's so hard. And like you, I mean, look, and I remember the doctors told me at the ER and then the urologist I met with the next day, because I was diagnosed in the ER, they both were like, don't Google anything. Well, okay. I'm a millennial. What do you think I'm going to do? I'm going to Google, right? Like, so I
You're gonna
Googled.
Google
That's what I
things. Yeah.
did. Um,
That's how we
yeah,
operate. We go online.
right. And so I think, that that's what the nuance unfortunately is missed because that's what you do. You Google, you look, and to your point, I have my youngest is autistic and so takes everything very literally, right? And
Hmm.
and so came to me and was like, well, mom, okay, you're going to die because it says that only 5% of people make it
Yeah.
to, after 5 years, after a stage 4
Hmm.
diagnosis, because at the time, the stats were even worse than they are now. Um,
Right. Right.
and I'm like, oh, I don't think so, but maybe, I don't know. Right. And so it kind of prompts all these
Mm.
difficult conversations that you have to have with your family, your friends. And, I think now it's, again, to my earlier point, like, I would handle things so much differently, but you just don't know what you don't know. I do want to make you feel better though. I think we all have had that 2 a.m. frantic, word vomit type of message to
Oh.
someone. I did it, like,
Oh yeah. Yeah. Yeah.
right?
I've spilled my guts to the like. I have never. I feel so bad for because Katie's the one who I latched onto because she was
Yeah,
like near my age,
right.
and she was very very welcoming. Like she had no business being as nice as she really was to me. She could have just said like the basic stuff, but she really did take the time to
Yeah.
um, point me to the right direction and also make sense of kind of what I was looking at. And um, I think that's important too. Like before you get diagnosed with cancer, you kind of always hear that word and you see breast cancer, you see colon cancer, you see all these huge foundations that are doing great work. And you see these, you see things like that. And then at this age, you get diagnosed with a cancer that affects generally folks that are like 60, 65, et cetera. And you go to the urologist office and you're sitting there like looking at your TikToks on your phone and everybody else is like 30 years older than you. Like, what is this person doing in here? And I always found it a little funny, kind of the questionnaires that I have to answer before the urologist appointment. Like most of those things, I won't go into the questions, but most of those things, as you can imagine, like are not necessarily applicable to me at 32 or 33 years old. But that's the territory that you are in when you get diagnosed with kidney cancer. So, but getting back to the, being able to spill your guts to somebody, I think that's something else that like and I think we've talked about it before, with men in particular. I found, like, in most of these groups, so I'm a part of a couple of groups on Facebook. I've been on Smart Patients before. I don't know. I'm sure you're familiar with Smart Patients. I'd be shocked if you weren't. Um, uh, I've noticed that a lot of men just do not want to talk about things. They'll post like once, like, "Holy crap, we just found a blah 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 tumor on my kidney. I feel like crap," et cetera, et cetera. And you'll get some responses here and there, but you never really see them post again, or you might here or there, but they don't really try to make those connections here or there. And what I've noticed, and again, this is just in like the span of 7 or 8 months, older men tend to not have that issue, kind of opening up and kind of expressing themselves and really digging into how they're feeling about this life. This is a life-changing thing, regardless of, there are different stages, there are different grades, there are different types of kidney cancer. But cancer, when you hear it, that you have it, it changes everything. There's not a, uh, at first, I wasn't sure if I should even go, like, try to help people or advocate, because I was a stage two. And, I think people hear stage two and they're just like, great, you don't have to worry about things. But when there's always a chance of reoccurrence with cancer. And when you sit there and think about it, I want to try to make those folks feel that there is hope. In fact, just 35, 35 or 40 minutes ago, a little bit before this interview, I had somebody reach out to me who saw something on, it was either TikTok or Instagram, I can't remember, but their dad has like a 11.5 centimeter mass, and they go for a CT next week, and they're just like terrified because they just assume that big mass equals, and of course they Google, et cetera, and they go down that rabbit hole, which I did too. Went down the same rabbit hole. And being able to be there for people, I think, has helped me in my stress and anxiety too, because I still get it. I still get those aches or pains, and I'm like, well, there it is. There's cancer knocking on my door. And I think being able to talk to people and letting them express themselves kind of talks some sense back into me too. Because I'm very guilty of not listening to myself.
Aren't we all? I mean, well, and I think that what you're doing is so important, and it's why I want to have you on the podcast, because you brought up a great point. We don't see a lot of. There are some. I want to be clear. There are
Mhm.
some men
Yes,
that
there
are
are.
active
Yes.
in the community. They're active patient advocates. But it's funny. I was at a conference. It was a grant review last year, and one of the oncologists that was on the panel, who I've gotten to know really well over the years, says, why is it always women? Why is it always women on these panels, right? And
Right.
and but he had a good point, right? Because I mean, statistically, men are more likely than women to be diagnosed with, with kidney cancer, right?
Hmm.
Um, but you know, from what I've seen, and again, I have known some men that are patient advocates. I know men that are patients, I know men that are caregivers that are active in the community, but it does seem to
Right.
be pretty female dominated. And you know, I think, and I'd like to hear your perspective on this. This is my very non-scientific, non-tested theory, but I think part of that is because I think men do have a harder time in general talking about their feelings, talking about,
Right.
right? They want to have that facade of, I'm strong, I'm tough, I can get through this. And I just think, man, there's no way I could have gotten through what I've been through if it weren't for the patient community. Because I also, even now, to
Right.
your point, 8 years later, I will message somebody, usually Katie, in the middle of the night, and go, I'm feeling this pain in the back of my, in my back. I'm dying, right?
Yeah. People need, like,
Yeah.
I advocates need advocates. Like, people need, just because 8 years later doesn't mean that you don't have those thoughts or feelings, regardless. And that's what cancer, and I've discussed this with other patients too. It takes the trust that you have in your body. If you have never heard of the word cancer in your doctor's appointment, and you had just gone about your life and you had some back pain, you'd be like, oh, I lifted something the other day. I probably just nicked it or slept wrong, whatever. But once you hear the word, it's just like, well, there it is. And it takes the critical thinking process out of the equation sometimes. But getting back to men, I think completely right. And honestly, I grew up not. I grew up the typical guy, typical American dude that I played football for 8 or 9 years. Um, and I didn't really start thinking about being a little bit more vocal uh, about these issues. Even prior to my cancer diagnosis, I had been seeing a therapist for 4 or 5 years. Right during COVID. COVID was really hard. My wife is a nurse practitioner. COVID was obviously exceptionally hard on her and exceptionally hard in return, kind of on me. And that's when I kind of started seeing a therapist because there was just so many things to talk about. But in that process, I started to kind of learn how to talk about what you're facing and how to navigate um, certain things that, a lot of stress and a lot of anxiety that was kind of buried underneath things, and just realizing like it's okay to feel those things. Like you don't have to hide that. It's okay. And it doesn't, for the people that, or for the guys that think that's not like manly or whatever. I think the best thing that you can do if you're trying to be a the tough partner in your relationship or what have you, or you want to be the stronghold, like you have those opportunities to do that. Just because you say that you're not okay at one moment does not mean like you're losing a race or something. Like it's not a singular thing. It's not a black or white thing. You can not be okay and still be considered the stronghold of your relationship or what have you. You don't have to not do that. And I would argue that people that are stronger, like that takes a lot of strength to say, hey, I'm not feeling great, or hey, I want to talk about this, or I want to talk about that. But um it's a lot of these talks or not a lot because I haven't been to a lot, but a lot of these presentations or patient forums and symposiums, etc. A lot of women, like to your point, it's usually a lot of women that are like taking it by the reins and being like, I want to figure out ways in which to get involved. But I have also met some extraordinary men that are doing well above, like punching well above, you know, where I could even think about punching, and they're doing great work. So I think, I don't think it's going to be solved overnight. Like I don't think all of a sudden we're just going to have a plethora of men coming on and talking about problems or talking about their issues anytime soon. But I think it's something that the more men are able to see that it's okay. Um, and especially with a diagnosis like this, it's not like, this is just you got the flu or something. I mean, it's a life-changing thing. So you have to be willing to open up about that, because if not, it really can eat away with you. And some people don't have to necessarily. Some people don't have to open up and share things. And if that's how you can process it in a healthy way, then I'm all for it. But for me, at least, I have found that being able to talk has definitely helped quite a bit.
Yeah, I agree. And I've been open before about how, I definitely struggle with my mental health whenever I was diagnosed. I mean, who wouldn't, right? I went from celebrating my 29th birthday to being diagnosed with kidney cancer, and I was actually at one point seeing two therapists. Like I was like, I'm at home, I'm on medical leave, I may as well just go sit in therapy. And, but
Right.
I mean, I think that it's so important because you know, you this is not just a physical disease. This is a mental disease, it's an
Yeah.
emotional disease, right? Whether you were diagnosed stage 1 and they find it early and it's in, easy for lack of better words, right? Nothing's easy about this, but an easy
Right. Yeah. Yeah.
surgery, right? Or if you're diagnosed
Hmm.
stage 4, there's emotional implications for that, for you, for the people around you. And I'm appreciative that my care team early on was like, you've got to have a therapist, you've got to have
Right.
kind of support outside of here because you're not going to get through this without it. And I think that the more that we talk about this as a community, it's really benefits everyone, because even if, to your point, you're not the type of person that needs to talk about their illness in order to process it, there's still some nuggets that you can capture from it. And I do want to also go back a little bit to what you were talking about with the those of us that are younger sitting in to the doctor's offices and everything, right? Because I think for me that was a real challenge, in the sense that I technically am an AYA patient. I still identify as an AYA patient, for those of you that aren't
hmm
familiar with that
You
terminology.
are. You are. I'll
Right.
tell you that. Yeah,
Yeah,
you are.
thank
Yeah,
you.
yeah, yeah,
Thank
yeah,
you.
yeah, yeah.
Right. So for those that aren't familiar with that terminology, AYA is adolescent and young adult cancers, right? But kidney cancer is not typically seen in our age population. And so while I found some resources for AYA patients to be really beneficial, I actually
hmm
identified a lot more with kidney cancer patients, regardless of their age, because the way that we treat kidney cancer is very different than the kind of typical, for lack of
Yep.
better words, AYA cancers. And so I had a hard time with that, because it was like, yeah, I'm having different quality of life concerns than a typical kidney cancer patient, right? Like I said, my kids were
1000%.
middle school when I was diagnosed, right? I
hmm
was, still am paying off student loan debt, right? Like I was
Same here.
in the prime of my working career, so I needed to get back to work so I could keep my insurance, right? So all those things that maybe a lot
Right.
of patients don't face in our disease type, but the side effects I was going through, the surgery, all that stuff, that I couldn't get any support from the AYA community. And so it's a tough,
Yeah.
I found it was a tough balance. Did you find it was a tough balance?
Yeah, so it's interesting that you mentioned that because when I first heard the word cancer, I think when you if you're not familiar with kidney cancer and then you're told that you have kidney cancer, I think the things that flash in your mind are what traditionally the movies tell us what
Right,
cancer is, right?
right,
And I will preface this by saying that is the reality for some people.
right,
But in regards to how far treatments have come, what drugs are out, what treatments look like now versus what even they look like 7 to 10 years ago, um, it's quite different in what you go through versus with traditional chemotherapy, right? Like with traditional chemotherapy, it's your effects, your adverse effects, et cetera, are a lot different. Some of them still follow some of the targeted chemotherapy that a kidney cancer patient might receive, but I found that as well, right? I've found before because I do follow some accounts that are AYA specific. And a lot of them, they'll have sometimes these like things where a bunch of patients will come together and talk about their different cancers. I'm the only one with kidney cancer. There's nobody like, there's not even anybody.
yep,
Usually, the typical cancers that you think
right,
are that are AYA follow that line.
right.
I'm usually the only one that's like, hey, kidney cancer. I have one kidney. So yeah,
Very
I
relatable.
completely Yes, very relatable. But I think that that makes a point that it's even more important to go out there and talk about what kidney cancer is. I think when you tell people that you have cancer, and even folks that are stage 4 now, with all of these treatments that are out there now, especially like I've talked to some of the first patients that I talked to were stage 4 patients. I didn't find a lot of stage 2 or even 3 patients because most of the patients that were active on these groups and social media are stage 4 patients or caregivers for stage 4 folks. And um, those were the people that I kind of chatted with first because those were the people that were most eager to kind of talk and share their story, which was, incredible. And I think realizing what I know now, I think it's even more important to get out there and talk about what kidney cancer is, what treatments look like. If you need treatments post surgery, I think there's still this thing where people assume that you get surgery and there's certain protocols now where you either do or you don't qualify for like an adjuvant therapy
Right.
post-op, and a lot of people get worried about that, but that's another thing where like education and getting out there and talking to other patients really pays dividends because kidney cancer is not your typical cancer.
No, it's not. It's not at all. And, and I think this is why it's so important that you and, people, I know that you're trying to kind of build more early stage patients in the community. And I think it's so crucial because, to your point, most of us that are stage 4 or stage 3 stick around in the communities because we're either actively going through treatment, right, or active surveillance. But there's typically a drop off in people who have been diagnosed earlier on. That actually scares me because a lot of times people,
Right.
okay, well, I had surgery, I'm moving on my life, and maybe they don't follow up on their scans, right? Maybe they get some not great advice from, from someone that says, oh, you can just go on with your life, right? And
Yeah.
that is true. That is true for a lot of people that, if you're diagnosed early
Yes.
stage and they catch it, most people will not have a recurrence. They will live the rest of their lives as is, right? But I
Correct.
do think that we miss something by not including more early stage patients like you in the community because we still need that awareness. We still need that data, quite frankly, and for research so that we can find more answers to kidney cancer.
Yeah. Yeah, well, and I would be the first to say that I felt very, and this isn't because other stage 4 patients made me feel this way. This was my own doing of how I felt this way, my own backwards thinking that I often do. But I felt like I didn't have um, I didn't earn that place to talk at the beginning, right? Like, and I see, I know, like that reaction, I knew that I was going to happen. That's not because of somebody's doing. That's not because a doctor told me that or a patient told me that. But I just assumed, like, with that diagnosis, even it was a larger tumor. There are people genuinely going through treatment. Some better than others, and regardless, I mean, it is a battle when you go through that. So I felt as if I didn't really deserve a kind of a place to talk. But that's my thinking. That is not like a patient telling me that. I will tell you, I don't think since I've been talking to kidney cancer patients, or really cancer folks in general, that I've ever had that type of like dialogue thrown at me, like, oh, you can't talk. Like, if anything, it's been very encouraging from you, from Katie, from a lot of folks. I always make jokes with Rachel because I have 2 or 3 very, very good friends from smart patients that are stage 4 patients, and they're like in their 70s. And I'm just like, some of my best friends are like in their 70s because
Yeah,
it's just hilarious. Rachel thinks it's the funniest thing in the world. But I think that if anything, I felt more welcomed
yeah,
into talking about different things because I think with I can't remember what study it was, and you probably have some insight to this, but it was something looking at like the anxiety of kidney cancer patients, depending on their stages, like of
yes,
reoccurrence, right? So
yeah,
how stage 1 patients felt, 2, 3, 4, almost all no matter the stage, you are stressed about
yeah,
reoccurrence, and no matter the grade, you're stressed. Now, granted, you're dealing with different things with different stages, et cetera.
yeah.
And I was very lucky that with my oncologist at Vanderbilt, like I did the reverse urologist first. I just dove into the water and saw Dr. Brian Rennie,
It
who
was
was
wonderful. Yeah.
yeah, I did the reverse thing. I just
Yeah,
I just like reached out to him on email. I didn't like go
yeah,
through the thing. I literally just emailed him out of the blue and was like, "Hey, I'm 32 and have a 10 centimeter mass on my kidney. Can I come see you and talk to you?" Like a psycho. And he was like, "We can get you scheduled to come." Well, if he was like, "I'm sorry to hear that. We can get you to come, yeah, and
yeah,
come see me." And to his credit, when I got my diagnosis, he was like, I don't think you really need to see me anymore. You can go about your life, but you will follow up with Dr. Chang, who is your urologist,
right.
for regular scans for a long period of time. I mean, that's kind of the pill you have to swallow. I've had some people before say, "Oh, it's a great thing that you'll get follow up scans and to catch anything early," and I do agree with that. But then it is that pill you have to swallow every time scans come around,
Yep.
and it's so hard to describe what anxiety
Mm,
feels like, because I think some people, and I don't think it's fair to expect everybody to know how that feels, because it's impossible, right? Like it's impossible for us to necessarily expect people to understand how that feels. I would say my wife being in the profession that she does, she understands that um, they're important scans and they could change things like that.
Right.
Um, but she is, I will give her so much credit because she's usually the logical person that's like, Sid, you know, your last scans were clear. This is what Dr. Rini said. This is what Dr. Chang said. Cancer can come back, but this is where we're at right now. And then I'm like, okay, I have to swallow my tongue a little bit and not jump off the bridge yet.
Yeah.
Yeah, because I'm, you know, I'm a nervous wreck
Yeah.
getting into things. But yeah, I would say that the follow-ups, right? I have seen people post before that they're like, oh yeah, my doctor said I'm all good. Like, woohoo, I can go live life. And you should go live
Right.
life. But it is extremely important that you follow up with scans because you see those stories from people maybe 20 years ago, 15 years ago that were clear, but then something randomly pops up and you're like, how was this missed? So that's just another kind of important fact that I would say about patient advocacy that I try to tell people all the time if they just found if a mass was just found on their kidney,
Mhm.
you need to try to go see a renal oncologist, somebody who sees this
Right.
often. Because while kidney cancer is rare, that doesn't mean whenever you say rare, people automatically assume like most aggressive cancer ever. That's not what that means. It just means that it's not seen as often in a general oncology office
Yeah.
as other cancers. Um, so I think that that's another important fact that needs to be shared more and more on social media because doctors, I was referred out first to a regular urologist from my PCP who was great. Urologist, the guy was great. He was very, and he, you know, he apologized to me a couple of times saying like, this is a terrible situation, but we feel confident. Like he was like, I think we can work on this. But once I started reading, and Vanderbilt's like 40 minutes away from me. And I
Right.
didn't know that Vanderbilt was home to some pretty good folks over there. So
Pretty great folks. Yeah.
yeah, yeah, I didn't know that. I knew Vanderbilt was awesome, and I knew that they had a lot of things going for them in the medical field. I didn't know that they also had some really great kidney cancer folks over
Yeah.
there, and that's where I made that switch. And credit to my physician, my PCP. He was like, "That's completely the right move." And even the oncologist that I saw first, the general medical oncologist, said that he was like, "I would recommend going to see Dr. Rini at Vanderbilt because that's like
Right.
the that's the gold standard." So I think it's very important to get that out there.
Yeah, it definitely is. And I think you bring up a good point that it's important not just for stage 4 patients like me, but for earlier stage patients too. I often try to explain to earlier stage patients that look, yes, most urologists could, perform surgery and remove your kidney, but going to a specialist can literally make the difference between having a partial versus a radical. So having part of your kidney removed versus a radical or all of your
Hmm.
kidneys removed. And, if you already have, either chronic kidney disease or other kidney issues, I mean, that is a huge difference. And so, that's why I like you. And I realize this is especially in the United States, this is a challenging message to give to people because of our insurance and everything else, right?
It's a headache, yes.
It's a headache to say the least. Yeah. But it really can make such an incredible difference. Yeah, I'm like you. You know, because my tumor was 13 centimeters, still a bit larger than yours, but mine was on my right side and was blocking my vena cava. And so I think I'm glad that I didn't know how serious that was at the time. But I knew it was
That's a
serious.
big surgery.
It's a big surgery,
That's a big,
yeah.
completely different surgery too,
Yeah,
compared to what just a normal. I don't want to
yeah.
say normal, but you know, just a nephrectomy,
No, but
right?
yeah, well, yeah, that was one of my first signs that maybe this was like really bad was the ER doctor told me, do not let anyone here in Vegas open you up. You need to go to California for surgery. And I was like, oh, okay. I know we have surgeons in Vegas, so
Yeah,
That's
you're like,
bad.
what's wrong with them? Yeah, you're like, what's wrong with
Right.
those surgeons?
And even the urologist the next day, though, then because he'd sent me with a local urologist in Vegas, and he was like,
Mhm.
"Yeah, there's one guy in town that might be willing to take your case." And I'm like, "Ooh, okay, that's not good." So that's how I wound up at UCLA, thankfully. But I don't know that.
Great hospital as
Great.
well.
Yeah,
Great,
great.
yeah, great hospital as well.
I'm very, very lucky to be at UCLA and to have them, taking care of me. But like, I don't know that every doctor has that conversation with their patient.
Mhm.
And to your point, like I always recommend that kidney cancer patients, whether they need surgery or not, see a specialist because you are being, whether you have to have surgery or not, whether you're being treated or not, right, by different things, the way that it is treated is so different from most other cancers that
Mhm.
I always say, look, ask the doctor. If you were not at at a center, right? If you're not at a specialist, ask the doctor, how many kidney cancer patients do you see a year? That is a valid question that you should be asking. If you don't like the
Yes.
answer to that, go see someone else, right? Go
Well,
see someone else.
yeah, and
People
I
get
will
scared and
say,
panicked, and I get it. I was panicked too. I was like,
people,
get this thing out of me.
yeah, people get, and this is another credit to Rachel, my wife. She's, like I said, nurse
Yeah,
practitioner. She was at a lot of these appointments with me. Not everybody has that. Not everybody has that luxury, and not everybody has the luxury that you pointed out to just like mosey on over to Vanderbilt and just be
right.
like, "Hey, can you see me?" Like, I things literally lined. We didn't have health insurance 3 or 4 months prior to my kidney cancer diagnosis. She had just gotten a job as a nurse practitioner. If this was found like a year ago,
Right.
well, a year before it was found, we would have
Yeah.
been up a creek. I
Right.
don't have to tell probably anybody listening to this how much a nephrectomy from any type of institute might cost, because it is
Right.
quite expensive. And I think your point also about like getting a surgeon that is a little bit more specialized. Dr. Chang, who was the one who operated on me, my mass was also, I can't remember if I told you this or not, but my mass was also attached to my tail of my pancreas in
Ooh,
my spleen.
okay.
And going into the surgery, there was a kind of a question on, because mine was laparoscopically done via the Da Vinci robot.
Mhm.
And there was question of, okay, well, if we get in there and it's kind of messy, we might just do open versus flapper, et cetera, all that kind of stuff. And thankfully, he was literally able to just heal away with the robot. And he was one of the ones because I did a lot of creeping on my surgeon before I was getting
Don't we all?
surgery. Because
Don't we all?
oh yeah, I went on Twitter. He's got a Twitter, of course. I was like, what are you tweeting about? Like, what are you up
Right.
to? Like, he's got pictures of his family and kids. I'm like, great, yeah, like, good guy. Like,
Right.
I like
Right.
the vibes going on. um and yeah, that sounds psychotic, but it is
No,
what it
I
is.
listen, I think we all do it. Okay.
People, this guy's cutting me open. I want to see what
Yeah.
he's up to. So
Yeah. Yeah. That's fair.
and getting into it, I kind of learned that this guy is, I mean, he is, every person that we had spoken to going into this surgery that had any relationship to just Vanderbilt, not even kidney cancer, but just Vanderbilt, said that Dr. Sam Chang was the person to go to
Yeah.
in this like southeastern part of the United States if you want
Right.
your kidney operated on. And he was one of the leading forces in getting robotics getting that started at Vanderbilt. I think if he wasn't one of the leading forces, he was one of the ones first
Mhm.
kind of doing it. He'd been doing it for he's been doing, I think he's been a urologist for 30 plus years, so longer than I've been alive. So it made
Yeah.
me feel very good and very confident about the surgery. But I go back and think like, okay, well, if I was not able to see somebody that was specialized in that or had done as many surgeries as he's done, what would the process look like? Because he even had um, uh, on my Vanderbilt Epic, the app or whatever that you look at all the procedures and your
Yeah.
results and all that kind of my chart or whatever. Um, the surgery was scheduled on there, and I saw that he also had on there a surgeon scheduled for my spleen and pancreas just in case they had to come out. It
Right.
freaked me out to no end, but it also, a lot of patients, to their credit, they were like, that's a sign of a good
Right.
surgeon, because
Yeah.
he's basically putting in place anything that could go wrong.
Yeah.
We have it covered. And my surgery, I had surgery on Monday,
Mhm.
and they wanted to send me home on Tuesday. Um, and I we kind of paused on that. We were like,
Yeah.
I feel okay. My numbers and everything looked fine.
Yeah.
I could have gone home Tuesday and it would have been fine. My numbers were fine. I didn't think it was like an unsafe thing. But Rachel even was like, why don't we spend the night, another
Yeah.
night, and just see how things are moving? And I went home Wednesday.
Wow.
And from what I've heard, that's kind of quick,
Yeah.
especially for like a larger tumor and this and that and
Right.
everything else. But I credit Dr. Chang. That's just another reason why I feel so strongly about getting back and helping them, because I credit him with saving my life, giving me a better outlook than maybe I could have had.
Absolutely.
So yeah, it's very crazy. But I wasn't sure if I knew that yours was attached to your uh, IVC. I didn't know that.
Yeah. Yeah. It
I
had,
think I knew yours was larger. I didn't know it was attached to your IVC though.
yeah, it had grown into my IVC, and they didn't realize until they went into surgery actually that it had completely blocked it.
Oh.
So they had talked about doing a IVC bypass, and then when they got in there and realized, oh wait, this is like, I mean, I was lucky to make it onto the table, honestly, because
Yeah.
that alone could have killed me. The blockage of the IVC, that is considered a medical emergency, and they knew from the CT scan that it was partially blocked, but because it wasn't until they got
Hmm.
in they realized how bad it was. But like you, my urologic surgeon had also scheduled, he had a co-surgeon who happened to
Yeah.
be the chief of surgery for UCLA. So,
It's good to
and
have on your hand.
yeah, right. Good to have. And actually, part of the reason why they had him in there was because, in there literally and figuratively, I guess, it's because um, I had to get my liver mobilized in order for them to, so they had to move my liver in order
Uh-huh.
to get to the full blockage of the IVC.
Uh-huh.
And I remember
Huh.
asking my appointment with the liver surgeon, I was like, okay, are y'all gonna put it back? Like, I don't,
Yeah, like
where are you
don't
moving
forget
it
that.
to?
Yeah, yeah, yeah.
Yeah,
Please do not, for like a post-it note, post-it something like put liver
right,
back in.
right.
So my Dr. Chang, it's funny because I am, and I don't know if you're like this, but I am, like I said, I can be psychotic. And I went into Dr. Chang's surgery notes and read
Yeah,
his,
I did too.
uh,
Yeah,
yeah, I read all of it, for better or worse. And I'm not saying that that's necessarily a good idea, because there is a lot of stuff on there that
yeah,
I have no clue what I'm reading, but I did understand some of it. And I was talking to him post-op. I think he came in he obviously came in the morning after my surgery, and then he came in the day that I was leaving to just kind of say, "Hey, see you later. We'll get back to you about the pathology report." And he was like, "Oh, and while I was in there, I was just talking to him about, like, I was extremely thankful that my other organs didn't have to be messed with." And he was like, "Yeah, while I was in there, I looked at kind of your liver and it looked good." And I was like, "Were you just like hanging out in my, like, what were you doing in there to where you?" But I mean, I guess I'm thankful for that, because he was like,
yeah,
"Yeah, like your liver looked good and this looked good."
yeah,
And just thinking about it. And I was also one of those people that like watched video of nephrectomy before it happened,
yeah,
because I'm, again, for better or worse, probably doesn't help with the anxiety, but I just really wanted to know exactly what, especially since it was done robotically. I I remember getting wheeled into the surgery room, and this thing was like sitting there. There was, like, a couple of nurses in there,
yeah,
and this robot looks like a transformer, is just like sitting there. And I didn't really know how to feel about it, better or worse. I knew that robotic surgery tends to lend itself to a little bit quicker recovery and all that kind of stuff. But still, just seeing that and just thinking, like, what happens if, like, somebody sneezes, or like something,
I know,
like something, yeah, like, what if the wheel like rolls over to
right,
the left a little bit? Like, these
yeah,
things are very, very sharp. If you've never seen, like, they're little sharp pinchers that are on there. and all these illogical thoughts that go into it. So, but yeah, the liver thing
Yeah.
completely agree with you. Quite weird.
Well, I know it is. Well, and yeah, I agree. I don't know that I recommend anybody to read their surgical notes because mine
Yes.
was
Yeah.
kind
Yeah.
of traumatic reading mine, honestly. They were like, patient surprisingly stayed stable, right? It's like, were
Yeah.
you
And you're like,
on
what?
TV too?
Yeah.
Okay, right. But no, but I think though, that to your point, like not, I always say knowledge is power. And so whatever we can do as a community, and this includes our oncologists, our surgeons, everyone else, right? To demystify things, I think is really important because it,
Yeah.
again, like that's why I said earlier, I know that I'm going to feel differently if I'm ever faced with another, with a recurrence because I know the back end now more than I did before. I want
Yeah.
to give us some time to talk about your social media. I know we kind of danced around it, but one of the things that drew me to talking to you was you went out and created a social media presence that I think is so refreshing, so wonderful to have out
Oh,
there. And so I want you to tell us a little bit more about it.
yeah. So, after I got my pathology report back and I kind of got a groundwork of what my next kind of what the map looked like moving forward. I wanted to. I found that humor was one of the ways I coped best. Some people don't like it, and that's perfectly fine. Some people it's a little uncomfortable for, but then they start laughing about it, and then other people just genuinely love it and can't and just. And I'm that person. I love humor, and I love laughing at things. And that's kind of where I got that idea from. And I also just noticed that there wasn't a ton of young adults necessarily on social media talking about kidney cancer. Katie was one that I saw like a lot, posting a lot. But what I will say about Katie is she was much more nuts and bolts driven, like very much more. She is in the weeds when it comes to things. Like when I have a question about something or understanding like a
I do the
scientific
same
journal that
thing.
yeah,
I do the
can you?
same
I'll
thing.
send her a link and be like, "Can you tell me like, is this what?
Right.
Am I understanding this right?"
Yeah.
And that like we need that.
Yeah.
But for me, I didn't see a lot of humor. I didn't see a lot of like a lot of it. Now, granted, there are some people out there, but that's kind of what I wanted to bring to the table because I was just sitting, like I said, I was sitting in that urologist office, and I was like, this is kind of funny, like that I am this young and I'm sitting here with this questionnaire asking me questions that I probably shouldn't have to answer till I'm like 60 or 70 years old. And I'm like, there's like, I can just tell. And you can like, people kind of look at you a little bit. They're
Yeah.
like, what? Not in like a, not in like a judgmental way, but like,
No.
what's going on here? Yeah.
Right.
Like, why is this person
Yeah.
here? Um,
Somebody thought I was a
and
rep one time while I was waiting to see my doctor. Because I went on my lunch break, from
yeah,
work,
yeah, yeah,
and
yeah,
she was like, you're a rep, right? And I was like, no, I'm
yeah.
here to see the
Or,
doctor for an appointment.
or are you lost? Like, are you in the
Right.
different? Are you sure you're supposed to be in the urologist area?
Right.
And I wanted to bring just a little bit of humor to that, and I'll say too, like I would say it's like 80% humor, 20% kind of what I'm going through. For instance, I don't even think we talked about this yet, but I got genetic testing done because that was, Dr. Rini didn't think that it was going. He obviously suggested it, but his opinion was it probably wasn't going to turn up anything just because of my family history, et cetera.
Sure.
But we got it done nonetheless because we wanted to make sure we kind of knew exactly what we were looking at, and it came back. Nothing was there, but I found that a lot of people were very interested in that because it either A hadn't been suggested to them, or B it had, but their doctor really didn't follow up about it, or C they are going to get it done and they're just kind of wanting to see how it was. And I found out later that I was kind of spoiled because Vanderbilt. I literally got a call from a genetic counselor from Vanderbilt, and they were like, "Well, we hire out a third party to do this." And this person came to my house
Oh, wow.
and drew the blood, was
Wow.
extremely nice, like such a personable. She's a phlebotomist, and she was so personable. I was like, if I ever have to get this done again, I want you to do this.
Right.
And came to my house and did it, and I got the results in like 3 or 4 weeks. So I add some of that information in too,
Right.
sometimes because I think that that's important. Like I think humor is a lot of what I love and what I want to kind of bring. I'll try to show Rachel every now and then, and she just thinks I'm the dumbest person ever. She's just like, "What are you doing?" But I will say that if I can just have one person smile or get something from it, then that's okay, because I didn't find a lot of that when I was kind of going through it. Like I found, like I said, a lot of nuts and bolts and a lot of things that was great information. But most of the humor accounts that I would follow when it comes to cancer, like you said earlier, was very much from a different type of
Right.
cancer. And you're not necessarily going through all those different things. Doesn't mean that you can't relate, and doesn't mean that you can't talk and speak to folks and commiserate together, but it is a little bit different. So I just came up with the name The Unremarkable Kidney because honestly, I went through like 50 different, because I run social media accounts for other organizations that I've worked for. So I kind of sat there and tried to come up with names. The little graphic that I have, I am not an artist by any means. That was all AI generated.
Love
So
it.
I did not create that. Yeah,
Yeah.
I did not. I did not create that by any means. If I tried to draw a kidney, it would probably look like a banana or an apple or
Same.
something.
Same.
Yeah, yeah, not an artist by any means. I'm much better at writing or speaking or communicating. So I came up with that, and I wanted to try to fill that gap a little bit. And it's been really helpful. And I will say, like, people do, and this is kind of like a larger scale conversation about social media, is that I really do believe that it has its place and it has its role. But people do need to take their breaks. People do need to set aside time to not always be on social media. I know that that's ironic coming from somebody who works in social media. But I think I've kind of had that first eye view of,
Right.
I mean, it can really kind of mess with your brain a little bit. And I think that it's important to kind of shut off sometimes and kind of and just be with yourself or be with the folks that you love, and kind of have that you and them time as well.
Yeah, I agree. You know, it's like the kids say now, like go outside and touch grass. Like
Touch
not quite
grass. Yeah,
right.
go touch some grass. Yeah,
Uh,
go
Although I
touch
know
some
they
grass.
usually mean it in a different way, but yeah, no, I think that, you bring up
Yeah.
I guess as millennials, we're not as cool as we used to be. So,
No, no, no,
but
no.
I think that's what I love about what you do on social, through the Unremarkable Kidney is because one, we need to laugh about some of this stuff. I mean, I've always said like humor has definitely been what's got me through a lot of this. Um, but also, to your point, there really has been kind of a vacuum in the space for kidney cancer. And you know, it's funny because I actually was at a conference, I won't say which one, but I was at a conference within the last couple of years, and a doctor who I respect very much, and is not in the kidney cancer space, to be clear, it was another type of cancer, but said, well, whenever people are diagnosed, they're not going on social media at first. And I'm like, you sure about that? Because
Yeah.
really did. And you
I
did the
mean, I
right.
am, yes,
Yeah.
definitely first place
Yeah.
I want it.
Well, and and my counter to that, I had a few counters to that actually, but one of my biggest counters to that was one, like there are plenty of people who are boomers and even, silent generation that are on social media, right? So, and
Mhm.
they're active, we see
Plenty.
in our communities, right? Plenty of people who are,
Yes.
Gen X or, boomers or what have you that are in the space and active. We're happy to have them in the space. But also, I
Thousand
know
percent.
that as the typical kidney cancer population's gotten older, it's adult caregivers who are millennials who are, taking care of mom or dad, or grandma or grandpa with a kidney cancer diagnosis. And where do we as millennials go for research? Social media, right? And I think
Social
that's only
media.
going to continue happening. And so, I my love-hate relationship with social though is that there's a lot of disinformation out there, right?
Oh yeah.
And
Yep.
so my thought process on it, and again, this is why I commend you for doing what you're doing, is because we need to have people that are vocal in the space that have presence, because if not, it will be sucked up by the snake oil salesman, right? I
Yeah, yeah,
know,
yeah, yeah.
I
The
know,
the
I
Facebook
know,
groups,
I know.
I I love I genuinely do love a lot of these Facebook groups because I
Yeah,
think that they do. I had a conversation with somebody who works within one of these kidney cancer organizations, and I talked about like I do find a lot of value in TikTok, but the conversation that we had was that when it comes to cancer, when it comes to cancer diagnosis, there's not really a group setting on TikTok, right? Like there's not
right,
a place to commiserate together. There's not a place to post, hey, I'm really worried about my scans next week. Can some, does anybody mind speaking, et cetera, et cetera. That's why Facebook works so well.
yeah,
Facebook, for better or worse, works so well for that. It's really the best place to have um, a kidney cancer group online. Instagram doesn't work. TikTok doesn't work. Twitter, I still call it Twitter. I don't care what people
I
say. Twitter
know,
doesn't work.
I know, I do
Yeah,
too.
Twitter doesn't work. So Facebook works,
Right,
but the other end of that is, and I noticed it the first week I posted on a Facebook group. First week, somebody commented and was like, "Oh, you need to drink this tea and this and that." And
yeah,
now me married to who I am, I know that that is just not correct.
right,
But I have seen conversations happen with these
yeah,
people
yeah,
where other people don't have that background or
right.
don't have that. And I don't blame people because the
Me
thing
neither.
that we've talked about cancer is it doesn't, I mean, it varies on stage and grade, but the experience itself, especially when you're first diagnosed, you're looking for everything. Like you're looking for every single thing that's in front of you. And when you have somebody that comments something on one of your posts, it's like, hey, my aunt did this and this,
Yeah,
and she's doing well. You're gonna reply back and try to figure out what exactly was happening. When in reality, you know, anybody kind of worth their merit or their name is going to recommend you go to an NCI center or a place that sees a lot of kidney cancer and
right,
have this conversation with your doctor. I find out like there's two roads. There's like an emotional road that I think is always utilized in these conversations. And then there's like the real medical stuff. Even when I talk to other patients about like the medical things I worry about, you can commiserate together emotionally. But at the end of the day, it's going to be a conversation between you and your urologist or oncologist to go about it. But that knowledge is power. Like I think the I'm not shocked that that doctor would say something like that because I've heard a variety of different things about
right.
social media that just isn't I just don't think is correct. And this is by no means a like I love social media. I think social media has its downfalls. Um, but we it's this is the world we live in,
Yeah.
and these are the tools that we have. So we kind of have to make the best of it. It just is what it is.
No,
um,
I totally,
so when we utilize those tools, it can I would not have known what I've known without a Facebook
right,
or without a TikTok or without a smart patients.
right.
Um, I would not have anywhere near the amount of knowledge. Now, I might have eventually ended up going to Vanderbilt and talking with Dr. Chang and Dr. Rini and et cetera, but there's no way I would have, and organizations do a lot of work to have these symposiums and these things that do valuable work. But in the day to day, when
Yeah,
people are on their phones and they're looking, they're scrolling through their phones at 6 or 7 o'clock after work, they're looking for information quick. Like they're looking. That's
absolutely.
just that's just how things are nowadays.
Yeah.
So they might not have the time to go to a symposium. They might not have the time to go to an event, and they just want that information there and then, and that's where the role comes in. So I'm not shocked by it, but I would obviously disagree a little bit.
Yeah, I do too. Well, and again, I agree with you that I never, I never judge a patient for or a caregiver for looking at alternative options, right? Because especially because people come at things from such different angles, right? A lot of us have had negative experiences with healthcare community before our diagnosis.
Hmm.
People are coming at it from different socioeconomic issues, right? And so I totally get that. I totally understand that. I think that's just why it grinds my gears whenever you see these people in groups that are, by the way, guys, usually bots, right? They're usually bots that are
Yeah,
just
they're not real
spamming.
people.
No, they're not. Yeah, they're not even usually real people. But it just grinds my gears because I'm like, look, everybody should have the right to make their own decisions about their health care. 100%. If you decide that's what you want to do, go for it. But you should be able to make an educated, informed decision about it, right? And so much of that just preys on people's fears. And that's why I just feel like if we're not in the space active in social media communities, it leaves a void for bad actors to come into play.
Yeah, it really is a unfortunate. It's like a double-edged sword,
Yeah.
right? Like social media has, like I said, I would not be as knowledgeable or comfortable with
Sure.
where I'm at in my diagnosis if I hadn't connected with who I connected with on different sites that I connected on, or even have the confidence to talk about. Like I had no clue what uh, aggressive features in kidney cancer were,
Right.
or what that what the renal vein was. Like I had
Yeah.
no clue what
I
any
didn't
of this
either.
stuff was. Yeah, no clue. So when you start talking to other people about their diagnosis, and you start looking at other people talking about their diagnosis, and you start seeing these different things, you do gain knowledge. And
Yeah.
this is a thing where I really do feel strongly about, because I have a great relationship with my primary care physician. He's not my cancer doctor, but he's my PCP. Um, and he is very much, he likes it when a patient is engaged in their care.
Yeah.
He does not want to, I don't want to speak for him, but he's not the type to just come in and be like, okay, I need you to do XYZ. We'll see you in 6 months. Like he wants somebody who's engaged in their care, asking questions, trying to figure out things, et cetera, et cetera.
Right.
And I think that that's valuable to have a doctor, an oncologist, urologist, that is able to have those conversations. And I think, like I know with and Dr. Rini, to his to his credit, the one of the first things I said to him was, I read online, and he stopped me right there, and he was like, "Do not go online and read things." And I was like, "Well, if and I do agree with him in certain aspects,
Yeah.
but I replied with that if it wasn't for being online and talking to other people, I probably would have never known to come see you.
Right.
Um,
Which is
I
true.
would have just
Yeah.
gone. I might have wound up in his office,
Right.
but without like, I mean, I must have had 20 people. I'm not joking. 20 people tell me that I need to go to Vanderbilt and see him.
Right.
So hearing that so often, I was like, okay, now I realize how important it is to go there. And that's all because of being online and connecting with other patients. And that's where I want to repay that, right? Like I feel like I have to, not have to, but I feel like there's an urge to repay that to other people, because I think probably one of the worst, and I don't have to explain this to you, but one of the worst feelings is that like first week, 2 weeks, 3 weeks, month, whatever of that, you have cancer. Like I would never wish that on somebody ever. That
Yeah.
I could like to go through that experience. And I kept hearing like it gets better. No matter what your diagnosis is, it gets better because you will have a plan in place. You will have doctors seeing you, and et cetera, et cetera. But I never imagined that, right? Like I always thought it was going to be this feeling of
Yeah.
like barely sleeping, waking up in the middle, et cetera, all this stuff. And it does get better. And I was only really able to kind of hold on to that little sliver because of other patients. So I think it's valuable.
I completely agree, Sid. And I always say we stand on the shoulders of the patients that have gone before us, because it's true. Again, I feel very strongly would not have had the outcome that I've had if it wouldn't have been for patients pushing me to find out more about my subtype, find out more information about what I was dealing with. And I think that is really the power of our social media communities and for things like what you're doing with the unremarkable kidney. So, Sid, do you have any
I
last
appreciate
thoughts?
it.
Of course. Yeah. Do you have any last thoughts for our audience today? Anything you want to leave us with?
Just that last point, right? Like, I think if you're listening to this and you have just been diagnosed, or you have a family member that's just been diagnosed with kidney cancer, or with any cancer, those first weeks are tough. Like, I think it would be like irresponsible to say that it's
Right.
not tough. I think that's very irresponsible to say. But it does, like, when plans start rolling, when the train starts going, it does get better with a plan. And that's like, that feeling, like I said, I never want to go through that feeling again. So it does get better. And I hope you're able to find some type of way post diagnosis to channel that energy, whether it's advocacy or just in your inner circle. Either way.
Thank you so much, Sid. This has been such a pleasure talking with you today. Thank you for all that you do for the community. And again, for our listeners, if you want to find Sid online, he's under The Unremarkable Kidney, although he's a very remarkable man. So that is misleading in itself.
We'll tell Rachel that too. Hopefully she can hear the end of this, and we'll get that online.
Well, thank you again. And thank you again to the Judy Nicholson Kidney Cancer Foundation for sponsoring this podcast, along with our corporate sponsors, Merck, Exelixis, and Ipsen. So thank you again. I'm your host, Laura Asfeller, and we will see you next month.